So I have to ask you, do you ever see spots before your eyes and wondering what those are? You know, it's not maybe your husband with a polka dot tie or anything like that. Well, we got John Hovhanessian here with Harvard Eye Associates. Doctor?
Always good to see you,
sir.
What a good introduction to the subject here on National Corn Fritter Day.
Corn Fritter Day.
I've been looking forward to this since 15 minutes ago when I heard about it.
No, I am too now. I really want those.
Sounds pretty good. If it's fried, it's food.
Yeah, I agree. So, you know, a lot of people have seen this. I think most people have seen what's called floaters. It happens occasionally. I can remember as a kid seeing it and then going to some museum one day up in the Bay Area, and they had like this exhibit. We're talking like maybe the mid-1970s.
Yeah.
And you look through this scope and it put spots before your eyes.
Okay.
The way you looked at it, and then it explained what it was. But, you know, that's occasional. So we're going to talk that versus somebody who maybe has them a lot, chronic.
Yeah, you know, so floaters are a confusing term, but virtually all of us, even from childhood, have some floaters. Floaters are imperfections in the back of the eye. The cavity of the eye has a large area in back that is filled with a gel called vitreous.
Okay.
And when we're young kids, it's almost perfect like water, but even then, it has some imperfections in it. And the best way to see your floaters, and we probably all noticed them from time to time, is if you look up at a uniform bright background, like looking up at a blue cloudless sky, you'll see tiny little squiggles and distortions. And they're hard to see because when you look at them, often they move to the side, right?
Yeah.
Right? Because they're not lined up exactly with your line of sight in the eye. They're somewhere off center. So looking at them, they just move away. And so it's hard to look at them, but you can still see them in your peripheral vision. And those floaters are perfectly normal. They're not an indication of disease. But then floaters can also become more severe.
Okay.
And this typically happens at some point in our life, not to everybody, but to most of us, when you get a sudden change in the vitreous gel. So here's a picture of the eye. And the main cavity of the eye, the vitreous, can have some imperfections in it, but what can happen is that the vitreous gel separates from the retina. It partially turns from a solid gel into a liquid, and then it starts to float freely. So you'll have these sort of condensations of protein floating around inside the eye, and I think the next picture may show a better example of that.
So is this liquid? What is it? How would you describe it as far as, is it thick mucousy? Is it when we're younger? Is it if it just spilled out, we wouldn't want that, but it would look like water?
So when we're young kids, it is a gel almost like clear Jell-O. So it has a real substance to it. If you set it on the counter, it would sit there. It would maybe settle a little bit, but it would retain its round shape. But as we age, it turns more into liquid with strands of protein within it. And those strands of protein are what we see then as these imperfections. When light comes through, they distort it. So in this picture that's on the screen, you see this gel, and there's a lot going on in this picture, including a retinal detachment. But if you look at the lower right part inside the eye, you see there's a separation of the gel inside the eye. So the sudden development of that separation of the vitreous gel will cause a sudden increase in floaters in patients who are having it happen. And this is by itself 90% of the time perfectly fine, and there's no retinal tear and no retinal detachment that occurs. But if you have ever a sudden onset of floaters that you didn't have before, or flashing lights that will sometimes come along with it, you want to get in to see an eye doctor within a couple of days at most, so that a good look at the retina can be done. The danger is that when the gel separates, it may also tear the retina. And in that picture we showed a little flap tear where it's like, when the gel peels off the retina, it's like you've got a wallpaper on the wall that's a delicate wallpaper, and we're peeling a sheet of Scotch tape off of it. Well, if we can get it to peel off cleanly with no damage to the wallpaper, great. That's an uneventful vitreous detachment. But if it tears a little flap in the wallpaper, now there's a defect, because this wallpaper, of course, is the retina. Fluid can pass through that tear and cause the retina to start to separate, and as that picture showed, you then have a retinal detachment occur. And when the retina separates from the wall of the eye, that leads to loss of vision in that area if it stays detached.
Now, is this correctable if it's detected early?
Right. So if the critical thing with a retinal detachment when it occurs is whether it crosses through the very center of vision. when you're looking at me, if you're looking at my eye, the center of your view is, is exactly, where your macula or the center of your retina is focused. And if that area of the retina is damaged or detached, it's much harder to recover completely your vision. So in a retinal detachment, yes, we prefer to detect it earlier, and that we do have surgery to reattach the retina. And those surgeries are highly successful if the critical parts of the retina have not been damaged yet.
Okay.
So that's why we recommend, if you have new floaters, within a couple of days you need to get into the eye doctor. And that doesn't mean call within a couple of days. It means if it's a Saturday, it probably can wait until Monday. Okay. But if it's Monday, call Monday and get in Monday or Tuesday or as soon as you can for an exam.
Can this happen, retinal detachment, through trauma? Once in a while you hear about a football player or whatever.
Yeah.
Boxers. A boxer or something. Yeah. And is that possible?
It is, because what happens in a trauma case, if you think about that gel in the eye, is suddenly a jarring force hits the eye, the gel shifts suddenly, and when it shifts away from a portion of the eye, there it can tear the retina. Okay. It's as simple as that. So you're accelerating that natural aging process and causing a more sudden, shift in fluids that can cause a detachment. So, whenever there's trauma followed by floaters and flashing lights. So what about flashing lights? Why do those happen?
Yeah, I've seen that before when, maybe you have a little bit of trauma, or, like when I was a kid, I banged into a wall or something. You're playing. Of course, back then, who knows if I had a concussion back? Get up, come on.
Many of us have been suspecting this for some time.
Yes, thank you. But you see that flash of light.
Yeah. Well, and in fact, you can induce it in yourself. If you close your eye and you kind of look to this side, and you close your eyes and you touch the outside of your eyeball over here just lightly, you'll see a flash of light on the other side. Why? Because what you're doing with your finger here is stimulating your retina. It's a fun trick you can play. Okay. And that stimulation of light is what I'm talking about. When you stimulate the retina, it doesn't feel pain. Yeah. It sees light. Okay. That's all it knows how to do. And so when the gel is pulling on the retina, it'll stimulate light. And so that the classic streak of light you'll see is just that, is a little streak of light, like a shooting little, like a shooting star, typically in the outer portion of your vision, that indicates the vitreous is tickling the retina, if you will. Okay. And that's a symptom that is common when a vitreous detachment is happening, with or without a retinal detachment.
Now, something like this, the increased floaters, retinal detachment, is that something that you can age-related, that like many things, maybe a certain percentage of people will get it? And
that's exactly right. So just like every other part of our skin and our tissues change over time, and when we're little, that doesn't happen. I brought my 10-year-old boy with me today, and he's here in the studio. And do we have a camera that we can get a shot of him there? Because when you're perfect in his age, you don't have any floaters and things like that. But as we age, as we have more birthdays, we are more likely to have detachment. The other thing that puts you at risk is the shape of the eye. And so nearsighted people are more prone at a younger age to have the vitreous detach. Wow. And nearsighted people are also a little higher risk for retinal detachment as well.
Interesting.
So, it is one of the risks of being nearsighted that we can't fix when we do LASIK or cataract surgery, because it has to do with the shape of the eye.
Interesting. One quick thing, middle of summer here, the importance of going out and protecting your eyes just like you do your skin. Now, I don't know if your boy is like my daughter. She always, Dad, can you buy me sunglasses, but never wears them.
Sure, it's the fashion statement for 5 minutes.
Right. Where I remember even as a kid, I used to like sunglasses, but she doesn't. We can be out and all over the place to the beach. It doesn't seem to bother. Yeah. So how important is that? Just good quality. They don't need to be expensive, but that's right. what you should look for in sunglasses.
In sunglasses in particular, something that fits well, that you're willing to wear, that's comfortable, that has good side protection. Right. And very often they're labeled with UV 400. That they're 100% UV, which is usually the same as UV 400. The other thing I want to encourage is swim goggles. I see kids at the pool. In fact, I'm no luckier or better than any other parent. Just yesterday, I went swimming with my 10-year-old, the same lad, and he didn't bring his goggles, and I didn't enforce it. And lo and behold, the next, when he got out of the pool, his eyes were all red and sensitive. Pool water is not clean, even if it's adequately chlorinated. There are organisms that grow in there that can blind you with infection that are very, very hard to treat. And so always, always have your kids and grandkids wear their goggles when they're in a swimming pool.
Now that's interesting. My daughter always has goggles. Always, always, where I don't. Now we were up just recently staying at a resort up in Alaska just last week. And you know, a lot of the newer pools use salt water. Not salt like the sea, but they don't use chlorinated.
Yeah.
It's done by the salt. And there I bought goggles because I opened my eyes and it just bothered me.
Yeah.
But she does. She'll
wear them religiously. Some people's eyes are more sensitive. It has a little bit to do with pigment. The lighter color your eyes are, the more sensitive you are. You know, my wife has darker brown eyes. She can put ammonia in her eyes and it doesn't bother her. And you know, people's eyes are different sensitivity. For me, I wouldn't consider being in a pool for a minute or the ocean without goggles because it bothers me. But whether it bothers you or not, you ought to wear them when you're in a swimming pool for sure.
I will do that. Thank you, sir. Always good to see you.
My pleasure.
All the fine folks over at Harvard Eye Associates, they're always nice people, knowledgeable, of course, but just fun to have on, so I appreciate it.
Thanks.
Thank you very much.
I feel the same way. Thank you.
And we will be back.